Why do some raw joints get damaged and others don't? Rheumatoid arthritis can be quite unpredictable. You might notice some joints are severely affected while others seem untouched. So why does this happen? The answer involves a mix of immune activity, tissue behavior, and individual factors. When rheumatoid arthritis starts, the immune system mistakenly attacks the lining of the joints, called the synovium. This causes inflammation, swelling, and pain. But not all joints respond the same way. Some joints experience more intense immune responses, leading to more damage over time. The level of immune activity varies from joint to joint. Certain immune cells, like macrophages and T cells, gather in some joints more than others. They release chemicals called cytokines, such as tumor necrosis factor alpha and interleukin-1, which promote inflammation and tissue destruction. If a joint has a higher concentration of these immune cells and cytokines, it is more likely to suffer damage. Another factor is the behavior of synovial fibroblasts, which are cells that normally help keep joints healthy. In rheumatoid arthritis, these cells become abnormal. They start producing enzymes that break down cartilage and bone, and signaling molecules that worsen inflammation. The activity of these fibroblasts can differ between joints, making some more vulnerable to damage. Mechanical stress also plays a role. Joints that bear more weight or are used frequently, like the knees or hands, may experience more wear and tear. This stress can amplify inflammation and accelerate tissue damage. Additionally, differences in blood supply and joint structure can influence how much immune cells and inflammatory signals reach a joint. Joints with better blood flow might have more immune activity, increasing the risk of damage. Your genetic makeup and environmental exposures can also influence which joints are affected. Some people have genetic variations that make certain joints more prone to autoimmune attack. The presence of autoantibodies like rheumatoid factor and anticyclic citrullinated peptide antibodies can also impact disease severity and joint involvement, although scientists are still exploring exactly how. The duration of the disease and how well it is managed matter a lot. Early treatment with medications that suppress immune activity can slow or prevent joint damage. If rheumatoid arthritis is left uncontrolled, damage accumulates over time, often affecting joints that were initially more inflamed or under more stress. Understanding these factors helps explain why rheumatoid arthritis doesn't damage all joints equally. It also highlights why early diagnosis and treatment are so important. By controlling inflammation early on, we can protect joints from irreversible damage. Every person's disease course is different, so working closely with a healthcare team to tailor treatment is essential. Remember, ongoing research continues to uncover more about why some joints are more vulnerable, which may lead to even more targeted therapies in the future. If you have rheumatoid arthritis, always consult your doctor for personalized advice and management strategies.